This is Dr. Paul Thomlinson from Compass Health Network. We're doing a continuing series aimed at inspiring hope and promoting wellness, particularly through the application of evidence to the challenges and issues of these times we're living in and living through. This episode is in celebration of Earth Day, which is an annual event held each April 22nd since 1970 to demonstrate support for environmental protection and sustainability. In case you're wondering about the so what here, just remember that the coalition and alignment of purpose created by the original Earth Day led to the creation of the Environmental Protection Agency, the National Environment Education Act, the Occupational Safety and Health Act, the Clean Air Act, the Endangered Species Act, many other laws and policies that have protected millions of men, women, and children from disease and death, and have protected hundreds of species from extinction. Those are the kind of outcomes that can only be achieved with collective action, an important phrase to remember for later in the episode. So I, along with my colleague and co-author Aiden Miller from Compass Health Research, have just returned from the National Council for Mental Well-Being annual conference in Washington, D.C., where we presented a research paper with tremendous relevance to Earth Day. In short, we reported a study we did on the amount of CO2, carbon dioxide, that was not released into the atmosphere during the first year of the pandemic as a result of switching over to telehealth. Obviously, when folks can log into their phone or computer and don't have to make a, say, 20 or 30 mile round trip to a clinic, it's going to save some exhaust fumes with tons of CO2 in them. In fact, if you're interested, we came up with a conservative estimate of about 7 metric tons of that particular greenhouse gas that was prevented in that 1 year, just for Compass Health behavioral health customers alone. Now, we geeky research guys were fascinated by that, but of course, it represents only a drop in the bucket of the reduction targets we need to hit in order to make a real dent in slowing or averting some of the fairly frightening climate change scenarios painted by the world's best climate scientists. I mean, have you read or heard much about these from reliable sources? I mean, it would be really easy to want to avoid that, which a great many of us do, or deny it, which another great many do. But honestly, part of the reason we did this paper was that we wanted to build a bridge to talking about the psychology of climate change. Why would a health and behavioral health organization like Compass be interested in talking about this subject? Because we think anything that can cause a decline in health and wellness of human beings is worth talking about, worth studying, and worth finding solutions for. Because the sheer enormity and ubiquity of the issue can be overwhelming and terrifying. We exist to inspire hope and promote wellness. So, goodness and science knows we need hope and wellness most of all in challenging times. So, this episode is going to focus on a brief overview of what we know about mental health effects of climate change in particular, with some thoughts about how we might approach these issues in a healthy and helpful way. Towards those ends, by the way, you'll hear other voices. An interview I was privileged to do with Dr. Schwartz, a clinical psychologist and climate psychology researcher from Suffolk University, and Compass's own Aiden Miller, whom I've enlisted to speak from the perspective of a millennial on what seem to be generational differences in climate change attitudes and concerns. So we should begin by acknowledging that we have a lot of work to do in better understanding the mental health impact of the climate crisis. But we have the beginnings of a science around the issue. We might call it eco-psychology. But this is all new enough that we don't have agreed upon names for the signature mental health condition related to this. Some have been suggested that include ecophobia, eco-anxiety, eco-trauma, solastalgia, eco-grief, and perhaps my favorite, eco-empathy. What's in a name? So let's talk about that. For example, ecophobia is a term coined by psychologists back in the 1980s to express not our fear of the environment or ecological calamity itself, but our sense of smallness in the face of it. Eco-anxiety, though probably most used in the literature, there's even a tool to measure it, may not be a great term. Why? Because it may not adequately capture or express the level of terror and horror and despair many people actually feel when thinking about the uncertainty of our climate, and even about our ability to survive what's unfolding in front of us. Eco-grief, another term, is deeper still, and may get at another important psychological issue here. We grieve when we lose something or someone we love, right? Much like the diffuse grief of the pandemic, we grieve the loss of predictability, normalcy, stability. And nothing could be more natural than feeling grief when we see a clear glimpse of what we've done to our home planet in many ways. I grew up in the 70s when there was a real dawning of the ecological movement, when Earth Day was launched in 1970. I have vivid memories of Woodsy the Owl telling me to give a hoot, don't pollute. And even more compelling, the image emblazoned in my soul when I hear the term eco-grief. Sandwiched between commercials for breakfast cereals and G.I. Joe with a Kung Fu grip was the PSA featuring Native American Iron Eyes Cody, astride his horse, surveying a polluted landscape strewn with trash. And at the end, the camera zooms in on his face to reveal a single tear sliding down his cheek. Eco-grief indeed. Or perhaps what Iron Eyes Cody was really expressing, and what we should maybe be calling it, is eco-empathy. Now that's my favorite term so far. Why? Because it speaks of connection and understanding. We only feel anxiety, rage, grief, etc. when we're connected to and care about something or someone a whole lot. And that term also inspires hope, because being directly, empathetically in tune with why we care about the environment, about climate change, can promote action over passive acceptance or even denial. As I've often said, we can endure almost any how if we're in touch with our why. Why do we care? Why are we doing this? We're doing this for our children and our children's children and all the other species that live and exist on the planet. And that's a lot of good whys. And one of my favorite articles that I read in getting more familiar with this interface of mental health and climate crisis is by Dr. Sarah Schwartz and her colleagues, just published this year, January of this year. And the reason I was so struck by it is that it gives us a bit of a roadmap. It gives us some hopefulness about what we can do to buffer against the anxiety of climate change. And so I took a shot and reached out to Dr. Schwartz to see if she would agree to be interviewed about the implications of her research. And she graciously agreed to do so. And I'm so grateful to her for that, especially given the fact that she was a bit under the weather and decided to soldier on and do the interview anyway. So let's give a listen to that. This is Dr. Sarah Schwartz, PhD, Associate Professor of Psychology at Suffolk University in Boston, and licensed clinical psychologist in the state of Massachusetts.
As we think about the mental health impact of climate change, the climate crisis, climate emergency, whichever you want to pick, what should folks be aware of in terms of that interface or that connection between mental health and climate?
Yeah, I think we're just seeing more and more how widespread it is. I know there was a recent study, a global survey of young people around the world, and 70% of them are feeling terrified about the future, and a majority are feeling like the planet is doomed. I think that we really need to move from thinking about climate anxiety as something that a few people are feeling and maybe conceptualizing it as an individual psychiatric disorder, to this is a widespread issue and an appropriate response in a lot of ways to the current situation. That said, I think what we saw in our study is that climate anxiety is widespread. On the other hand, there are some people who we're seeing an overlap between both climate anxiety and major depressive disorder, generalized anxiety disorder. So I think we want to both be acknowledging this as something that people are feeling all over and isn't an indication of psychopathology. On the other hand, it can contribute to psychopathology. And for folks who may be already vulnerable to psychiatric disorders, that this exacerbates it. And I was just talking to a colleague who works in an inpatient unit for young people, and he was saying he started focusing on climate change research because it was coming up so much in this adolescent inpatient unit. So I think particularly for young people, the research really shows that young people are feeling a lot more anxious about climate change than older generations.
Absolutely. Yeah, I'm in the midst of doing focus groups for young people in our service area on mental health challenges, needs assessment, and it's coming up over and over. Just that general sense of dread. Existential dread has always been with us as humans, right? But it's like it seems like it's maybe got a finer point on it now for many, especially younger folks. And I'm fascinated by that generational differences and the anger that I'm hearing from folks about, like, I'm thinking about that song by Mike and the Mechanics from years ago. Every generation blames the one before, and all of their frustration come beating on their door. And that's never been more true than now, I think, in a lot of ways.
So the research does seem to be pointing to very different perceptions and reactions to climate change and the climate crisis between generations. That is, it seems to be more accepted as a fact of life among younger folks, and there's more denial among older folks maybe. So I wanted to hear from a younger person on this very issue. So I asked my colleague and co-researcher Aiden Miller about whether he sees these generational differences playing out, whether it squares with his experience and perceptions. And not that he can speak for an entire generation, but as a so-called millennial, I wanted to get his perceptions of the mental health effects of all of this among folks of the younger demographic. And he had a lot of wise things to say.
Well, thank you for the question, first of all. One of the prevailing feelings I've gotten when discussing the topic of climate change with older individuals is a sense that this is just another disaster, or this is just another doomsday scenario. And in that sense, I also feel for those individuals, because throughout time there have been a lot of these world-ending things that have probably taken a toll on their psyches and the believability and the credibility of these predicted events. You have Y2K, the 2012 Mayan calendar. Nuclear war was at the forefront, and it shares a lot of qualities, like it's a man-made thing that the actions of other people are going to really radically affect your future, and the planet is going to be the one to actually face the brunt of that. So while the younger generation is just looking at the world around them, and myself included in this, and we just look at it and we just say, why is this even a discussion? Why do we have to keep going over whether or not this is real or not, or what we should be doing about this? The coral reefs are dying and the ice is melting. Why isn't anyone doing anything? Certainly not everything applies to everyone, but generally there seems to be a better connection overall with younger folks and their mental health. Less burying of the subject, and understanding that it is just as important as physical health, because it all comes together as health. The true frustration comes from this idea that we don't have a lot of agency in the matter. Governments are typically not made up of younger generations, and I think those voices are feeling ignored in this. This topic is especially frustrating because the people who are going to face the full burden, the full brunt of climate change are the ones who aren't making laws, who aren't being listened to. Young people are feeling sad, afraid, anxious, and angry about this, and then all of that is multiplied by a feeling of helplessness on the issue, because they aren't being heard, and they sometimes the exact opposite of what they're fighting for is what's being done. Also, if I can just give any advice from a personal place right now, it's to go out and plant a tree. It is fantastic. I am raising some seedlings, and it really has helped me in an emotionally difficult time to stay grounded and feel productive. There's a Chinese proverb that I read that said, the best time to plant a tree was 20 years ago. The second best time is now.
So the lived experience here seems to be entirely consistent with the research findings Dr. Schwartz and I discussed earlier. And that proverb Aiden mentioned deserves repeating. The best time to plant a tree was 20 years ago. Second best time is now. So in that hopeful vein, let's go back to my conversation with Dr. Schwartz to talk about how to buffer against the mental health effects of climate change through taking action collectively.
If I read your study right, the collective action served as a significant buffer against climate anxiety, not so much for individual action. What are the implications for folks?
Yeah, no, that you got that exactly correct. And I think it is really interesting that we saw this buffering effect for collective action, but not for individual action. And I think in some ways that's particularly striking because in open-ended responses where we were just asking folks, what are you doing to address climate change? The vast majority only were speaking to individual action. And I know that that's something that I see. I'm teaching a class right now to psychology majors about climate change and psychology. And again, I think in some ways, because of frustration with the systems, a lot of folks have turned to individual actions, but I don't think it has the same protective effect, both in terms of individually and psychologically, and in terms of having an impact on the future. And so that isn't to say that engaging in individual action isn't worthwhile. And I think that for some people, it also can be kind of an entry point to engaging in more collective action and feeling more efficacious related to climate change. But if it's substituting for collective action, if folks are putting all of their energy into getting to a zero waste lifestyle individually, that's time and energy that potentially could be going into activism, political action, boycotting, a lot of things that really can happen collectively that can't individually. And I think our research wasn't causal, but our theories are really that collective action also plays a role of social support. And particularly for the young adults that we were talking to, there was this sense of hopelessness, as you pointed out as well, and existential dread, and all of these things that are particularly scary if you're feeling like you're dealing with them on your own. But if you feel like you have a community who's facing it with you, it's less scary.
Yeah, for sure. You think about therapeutic factors of group psychotherapy, universality, we're all in this together. And again, I'm struck by that. I mean, my goodness, and I'm sure you've probably even written about this, that the parallels between this and the pandemic, the collective action needed to actually be efficacious in doing something about it, bending the curve, as we heard about a million times, all that, like the parallels are really striking and also kind of disheartening when you think about how poorly we did in some ways in controlling the pandemic. Again, the focus here is on hope. So what kind of strategies would you recommend, or how do we go about getting our arms around collective action a little bit?
Yeah, so that could mean a lot of different things. And I think often people hear activism and they think that only means, going to a protest or going to a rally, which is one part of it. And I think a piece that actually can be really helpful, particularly from a mental health perspective. On the other hand, there's so many different ways. And we had a scale of collective climate action that had all different possibilities. It could be going to an educational event, holding an educational event. It could be not buying from certain companies. It could be writing a letter to the editor. It could be engaging on social media. So that there's a lot of different ways, but the idea is trying to address systemic issues, trying to change what's happening on a political level, trying to educate others and move beyond just individual carbon footprint to what's a community doing, what's a society doing. And I think, just speaking to your question of what we can take away, particularly in terms of hope, I think, it's so clear that so many young people care about this issue. So we have the numbers. What's the quote about, it only takes a few people who care a lot about an issue to make a change, my paraphrase.
Me and the Lorax, I believe. We're very close.
Lorax, exactly. Love it. That there are so many young people around the globe who care about these issues. And I think if we can translate and channel that energy into collective action, that there really is incredible hope for transformation, not just, surviving, but really building a transformative future. And I think the last thing that I'll add is something that came out in some of our open-ended responses and some focus groups that we're doing now is, for some young adults, also the sense of kind of lack of purpose or loss of purpose. What do any of the typical young adult milestones mean around, graduating from college, getting a career, starting a family in the face of climate change? And, a lot of young people are saying, I always wanted to have kids, and now I don't think that's in the future for me. Or what's the point of me even getting this degree if I don't know how long the world is going to last? So there is this this fear, the sense of all these typical young adult milestones that we think of as, important to healthy development, that it feels like climate change for some young people has really torn those away. That said, I think that also this sense of engaging in collective action can give folks a sense of purpose in a way that I'm not sure individual action has that same sense of, I have a purpose, I'm part of a community, and we're working on this together. So I think my hope is that we have so many young people who care about this issue, who want to build a better future and are looking for a sense of purpose. And again, I think that there is really incredible potential for channeling that.
Cheers to that. I love how you said that. And Dr. Schwartz, thank you so much for taking your time to help us inspire hope and promote wellness. I mean, one of my favorite songwriters, Bruce Coburn, has a song that says, we got to kick at the darkness till it bleeds daylight. And I feel like that's what we're trying to do here a little bit. So thank you for helping me kick against the darkness a bit. Appreciate you very much.
Yeah, no, thank you for sharing that quote, that song line. I will hold on to that. And for this opportunity. I'm so grateful whenever anyone's bringing attention to these issues, because I think conversations are where it all starts.
Conversation is where it all starts. Let's have more conversation about all the hard things, all the things we absolutely must have collective action to solve, to help, to heal. And climate change or climate crisis is just one of them. I hope you found something useful and hopeful in these conversations. And again, my thanks to Aiden Miller and Dr. Sarah Schwartz for contributing to this episode. I'll close with a wonderful thought we heard at the National Council for Mental Wellbeing Conference last week. The only other climate change presentation besides ours was from Dr. Gary Belkin from Harvard University. He said a lot of great things, but this one stuck with me. We need a sense that we are a part of nature. We are not apart from nature.